have one of the highest ratios of mental health patients to providers in Pennsylvania, and many of our residents face long wait times to get help. Compounding our issue with access to care is the stigma that continues to surround mental health. So we're fortunate to have a passionate advocate in Mike Veny with us tonight, who's so open and willing to share his story with us. As a mental wellness superhero, Mike's mission is to transform the stigma around mental health care. Please give a warm York welcome to Mike Veny.
As my audience, I'd like you to blindly trust me on this journey we're about to go on. I promise you, if you listen to what I say with an open mind, by the time you leave here tonight, you'll actually have some practical tools that you can use to transform stigma starting tonight.
Sadly, our neighbors with mental health challenges are more likely to decline into poverty.
One of the things we were trying to do in Pennsylvania was exactly what York County is now trying to do, which is reduce the stigma around mental health so that people are not afraid to talk about it and that people are willing to identify and to seek help.
So we're going to be talking about mental health. And when I use the term mental health, we're talking about three things: thoughts, feelings, and behavior. If one of those is having a challenge, you have a mental health challenge.
So I said in the room, so how many of you senators up there have a family member who has a mental illness? And it was just like this room. Everybody just sat there.
Interestingly, we cannot see someone's thoughts. We often think we can perceive someone's feelings, but you can absolutely observe their behavior.
People are afraid to talk about it. People are afraid to say. And all of a sudden, it was the majority leader now, who was the appropriations chair then, raised his hand and he said, I have a brother. And he told his story. And then another one of the senators said, I have a story to tell too. And that was the first time I felt like actually we were connecting and getting our message across as we talked about mental health and the need to reduce stigma.
According to Merriam-Webster's dictionary, the definition of stigma is a mark of shame. But interestingly, stigma is also about thoughts, feelings, and behavior. Thoughts are stereotypes. You might have had a stereotype in your mind about what you might hear tonight at this event. Feelings are prejudice. Maybe every time I'm in the room, you get uncomfortable because I have mental health challenges. And behavior is discrimination. And people experience this in different ways in all walks of life. When I started to try to learn about stigma for myself, I actually found two reasons stigma exists. And check this out. One is that mental health challenges are confusing and frustrating. They are confusing and frustrating. And we as humans, we don't like to be confused. No. I was in the gym working out and I was doing one of these push-up routines where you put your hands in different positions. I was trying to impress some girl, yeah. And so, of course, I ended up hurting my wrist, right? And so I totally played it off, left the gym, and went home to ice my wrist. And I knew that after a few days, if it didn't heal, it was either a sprain, a strain, or a broken wrist. Mental health challenges don't work like that. They are confusing and frustrating, and you end up usually discovering them through someone's behavior over time. The other reason stigma exists is what I like to call the law of the tribe. We are tribal people by nature, even those of us who don't like people in the room. And you can see where stigma begins with the tribe in kindergarten. If you watch kindergartners socialize, so let's just pretend like the four of us, we're in kindergarten. That'd be cool, right? And we're sitting around chatting. The way kindergartners learn who is in the group is by identifying who is not in the group. And they usually call that person the weird one. So let's just say the three of you are sitting there and you have Nike sneakers, but I have Pumas. They're gonna call me the weird one. And we bring this with us throughout our lives, and in every group we're involved in as adults, nobody wants to be the weird one. You put that law of confusion and frustration plus the law of the tribe together, and that's why stigma exists.
I am so proud of York County's United Way for taking on this challenge. It's a huge challenge. As I look around the room, I see all your partners, and you are so fortunate, and we are, all of us in York County, to have such amazing partners.
We all have a lot of work to do around the issue, and I applaud the United Way for organizing the event, our inspirational speaker Mike, and our panel for being here to educate us further.
Tonight, our warriors unite, and we launch York County's largest annual giving campaign. We have a stellar team of generous donors, engaged volunteers, and dedicated staff. We are primed for a successful United Way campaign to make our community stronger.